Hello, this is Nathan Carlson coming to you from the 24-Hour Flex Studios. And today I'd like to talk to you about some of the changes that are going to come about starting January 1st, 2011 with respect to over-the-counter medications and drugs. These changes were brought about by the Health Care Reform Bill, otherwise known as the Affordable Care Act. This act redefined eligible medical expenses. These new rules apply to medical flex accounts, but they also apply to health reimbursement accounts and health savings accounts. Effective January 1st of 2011, over-the-counter medicines and drugs will only be eligible with a prescription. These new over-the-counter rules do not apply to insulin, and they do not apply to over-the-counter medical supplies, and I'll explain the difference between a medical supply and a medicine or drug. So what is eligible? As always, prescribed medicines and drugs are eligible expenses. Over-the-counter medicines and drugs obtained with a prescription, insulin, and over-the-counter medical supplies are eligible expenses. So here is a list of some of the eligible medical supplies: contact lens solutions, bandages, ACE wraps, crutches, walkers, wheelchairs, medical devices such as maybe a blood pressure device, hearing aids, denture bonds. These are all medical supplies that are eligible right now and will continue to be eligible in 2011 and thereafter. Here are some examples of ineligible over-the-counter medicines and drugs: cough, cold, and flu medicines, pain relievers such as Tylenol, stomach remedies, digestive aids, anti-gas products, acid controllers. These are all ineligible starting January 1st. A few more examples: allergy and sinus medicine, antibiotics, anti-itch and insect bite, laxatives, sleep aids and sedatives, antifungal medication. These are all ineligible starting January 1st. So when is it effective? It's effective with purchases of over-the-counter medicines and drugs that are made after December 31st of 2010. And this date applies to all plans and all plan participants. For example, many of you have a cafeteria plan that is on a calendar year basis. And so starting January 1st, all purchases of over-the-counter medicines and drugs will not be eligible unless you have a prescription. It doesn't matter if you're in the IRS grace period or if you're in the run-out period for your cafeteria plan. Also, some of you are on a fiscal year cafeteria plan, meaning your plan year started, say, July 1st or it started April 1st. Doesn't matter when your plan year started. This is a hard fixed date for all plans and all plan participants. Some common questions here. Will the insurance copays and deductibles still be eligible expenses? Yes, of course. Those will continue to be eligible medical expenses. Will the debit card continue to work for over-the-counter medicines and drugs? No. Starting in January, the debit card will not work. The debit card companies will reconfigure the card so that it does not purchase or allow you to purchase on the debit card medicines and drugs. Will the debit card continue to work for over-the-counter medical supplies? And the answer here is yes, it will. So if you're purchasing Band-Aids or ACE wraps, crutches, walkers, wheelchairs, etc., some of those medical supplies, you can continue to use the debit card to purchase those items. Are over-the-counter medicines and drugs eligible with a prescription? And the answer here is yes. But then the question is, who can write that prescription? This rule varies state by state because the rules on who can write prescriptions are determined at the state level. And here in Colorado, it must be a physician or a physician assistant or an advanced practice nurse. And there are a few other professionals that can write prescriptions. We have more information on this at our website at 24hourflex.com. So how do I get reimbursed for over-the-counter medicines and drugs? You'll need to complete a claim form because now these items cannot be purchased on your debit card, and so you'll have to purchase them and pay for them yourself, fill out a claim form, attach a receipt, And then you have to now attach a medical professional's prescription. Is it possible that after the November 2010 elections, this over-the-counter rule could change? And the answer here is maybe. I want to point out that the rule is as I have stated it, but there has been legislation introduced by the Republicans in both the House of Representatives and the U.S. Senate that would repeal these new over-the-counter rules. So we'll see what happens with that. At any rate, let us know if you have any questions. You can always call our help center. You can go online at 24hourflex.com and get more information. Thank you.